All right, Dr. Ligan, the floor is all yours. Thank you.
Okay, thank you. Okay, good afternoon. Well, we want to share with you that today we received our first shipment of Moderna vaccine, and actually this shipment contained a total of 15,000 doses of the vaccine, and this 15,000 doses will be administered to healthcare personnel here in Clark County. Uh, Today, uh, in total, between this week and last week, we have received 27,675 doses of COVID-19 vaccine. The first 12,000 doses were from Pfizer, and all those doses were already distributed to our local hospitals. I also want to mention that during the course of this week, an additional 16,478 doses of Moderna will be shipped directly to Clark County hospitals. And that will help them go through the first phase of vaccination with the hospital staff. Also, long-term care facilities in Clark County will continue to receive the vaccine shipment from pharmacy suppliers in case we're talking about CVS or Walgreens. I also should tell you that those shipments of vaccines will continue to arrive here in Clark County and across the state. And we are expecting, of course, future shipments in January from both Pfizer and Moderna. I also want to mention that Joanne Rupiper, who is our chief administrative nurse and also director of clinical services, will be joining me on this call. And Mr. Cory Borges will be facilitating the call. Please, we are happy to take questions at this time.
Just a reminder, if anybody has questions, use the raise hand feature. If you're on the app, it's under the participants list. If you don't know where the participants list is, click on the participants button at the lower portion of the Zoom window. Okay, our first question right now comes in from Cynthia from Telemundo.
Buenas tardes. Hi, everyone. Doctor Fermín Leguén, si nos puede dar exactamente toda esa información en español, se lo agradecería mucho.
Okay. Okay. En el día de hoy recibimos el primer envío de vacunas de la compañía Moderna. Estas vacunas contra el coronavirus son un total de 15,000 dosis que serán administradas a personal de salud en el condado. Hasta el momento hemos recibido entre la semana pasada y esta un total de 27,000 dosis de vacuna aquí en el Distrito de Salud. El primer envío de vacunas fueron 12,000 vacunas de la compañía Pfizer, que se adicionan a las 15,000 dosis de vacunas de Moderna que les mencioné anteriormente. También quisiera destacar que durante el transcurso de esta semana, los hospitales de condado van a recibir un total de 16,000 dosis de vacuna Moderna. Y estas vacunas, por supuesto, van a ser utilizadas para completar la vacunación de todo el personal que trabaja en nuestros hospitales. Los hogares de ancianos van a seguir siendo vacunados a través de las farmacias, ya sea Walgreens o CVS, que es un contrato con el gobierno federal. Nosotros seguiremos recibiendo envíos de vacunas tanto de Moderna como de Pfizer en el transcurso de las próximas semanas. Y igualmente, una vez que se añadan nuevas vacunas que sean aprobadas por uso de emergencia por la federación, por el gobierno federal, la FDA, pues estas vacunas se irán incorporando y serán recibidas aquí igualmente. Y también quiero señalar que se encuentra conmigo Joan Piper, que es la jefa de enfermera del Distrito de Salud y directora del Servicio Clínico. Gracias. Thank you, Corey.
Okay, next up we have Jacqueline Schultz from Fox 5, and I'm unmuting you now. Okay, go ahead.
Hi, Jacqueline here. Can you hear me?
Yes.
Yes. Okay, great. First question, as we're heading into nursing homes now, what is the next step as we get through tier 1? Is it going to kind of look like a, is there a plan to get onto the next batch of the tier 1 maybe next week or the week after? And then a follow-up question, this is in regards to staffing of sites. I'm told that there's kind of a mass hiring effort to staff these vaccination sites, administer doses around the county and the state, if we can talk about the need for medical staffers. So whichever question.
Okay, I will start with the second question, and then Joanne will tell you about all the tiers and all those vaccination phases. And the answer to the second question today is very simple. We, the health district, at this point is not engaged in any hiring of staffing for vaccination efforts. And the reason for that is because we have not received any additional funding for that purpose. We are expecting to receive funding for the vaccination campaign in future days or weeks, according to the package, the relief package that was approved by Congress last night. But at this moment, we are not engaged on that activity. Thank you, Joanne.
Yes, Jacqueline. So the tier groups, we have plans in place for all of tier 2, or I'm sorry, tier 1 for the next few weeks, hoping to complete that at the end of January. So we'll move on to the next tier, which is the psychiatric hospitals and behavioral health. We're already working at getting vaccine out to them today. And then we'll move on to our first responders, our EMTs. And we hope to, once we get our vaccine for them, then we will distribute that to the EMTs that we have trained, and they will start vaccinating. So it's working well. We have some partners in the community, some university partners, and schools that are going to assist us with pods in that particular tier groups, especially when it gets to laboratory workers and pharmacists and dentists, medical staff. So that one medical group is very big. It's a large group. So we have partners that are ready to help us out and independently run those pods. Does that answer your question okay?
I already muted her, I'm sorry.
Okay.
Up next.
Put it in the chat, Jacqueline.
Next question comes from Fernando. I'm unmuting you now.
Hi, my question is for Fermín Leguén, in Spanish. Hi everyone, hola Fermín Leguén, buenas tardes y gracias por darnos esta conferencia. Queríamos preguntarte, sabemos que estamos en una fase muy inicial de la vacunación, que la prioridad en estos momentos, como bien decían, sí son el personal sanitario, personas de la tercera edad, pero queremos saber algo que nos preocupa a nuestra comunidad, ¿no? A la comunidad hispana. Sabemos que la comunidad hispana ha sido duramente golpeada, que ha sufrido de especial manera el COVID-19. ¿Tiene el Distrito de Salud algún plan, aunque sabemos que es una fase muy inicial, de de enfocarse en lugares con una proporción más alta, con mayor incidencia y por ende también en la comunidad hispana, o por el momento no?
Gracias por la pregunta, Fernando. Bueno, la respuesta a esa pregunta realmente corresponde a cuando salgamos de las dos primeras fases de la vacunación, porque la primera fase es la que estamos en este momento, que mayormente está enfocada en personal de salud y personales que son los que se llama de respuesta inicial a problemas en la comunidad, como son ¿sabes? Bomberos, los servicios de emergencia, policía, farmacias y otros grupos que apoyan esa actividad. Y la segunda fase de la campaña de vacunación es una campaña, es una fase en la cual todavía la vacuna va a estar limitada a la oferta a ciertos grupos dentro de la comunidad, que son lo que se llaman servicios esenciales que se brindan a la comunidad para asegurarse de que, bueno, que se recupere la economía, se recuperen los servicios sociales y un poco que se ayude a entrar dentro de la normalidad. Y ya después que se completen estas dos primeras fases, entonces es cuando ya se empieza a trabajar directamente con segmentos ya más amplios de la población. Y ahí es donde sí vamos a enfatizar las áreas que conocemos que tienen la mayor número de casos o de incidencia de casos de esta enfermedad, que son áreas que mayoritariamente están habitadas por residentes de origen hispano o de minorías de afroamericanos y otros grupos. Pero eso va a suceder en la tercera fase de la campaña, que de acuerdo con la distribución de vacunas que estemos recibiendo, no esperamos que suceda antes del mes de marzo o abril, porque tú sabes que estas vacunas que estamos utilizando son vacunas de 2 dosis. Y por tanto, todo el que se vacunó esta semana pasada, pues tenemos que volverlo a vacunar ese mismo grupo en la primera semana de enero. O sea que eso te atrasa mucho en la velocidad de la campaña. Gracias. Thank you, Cory.
Next on our list, we have Mr. John Trainer. I'm unmuting you now.
Hi, yeah, thank you. Now that Moderna is here, as well as Pfizer, once we start thinking about tier 2, tier 3, tier 4, will people have a choice as to which vaccine they get, or is this going to be kind of a random thing?
Well,
I hear a baby.
Yeah, excuse the child. We're gonna
No, that's okay. Aw.
Johan?
Yes, so possibly. Usually, especially with Pfizer vaccine that has to be used within 5 days, we will probably take one product to our mass vaccination clinics just because we may need to use it within 5 days. Moderna, we're reserving for those hospitals or situations where we don't have the capability for the ultra frozen. So it really depends. I can see further on down the line that, you know, once it's in readily available within doctor's offices or your healthcare provider, there may be some choice, but that's a few months away.
Yeah, I mean, right. Thank you, Johan. Yeah, the short answer is yes, that eventually will happen, but it's going to be, I would say, relatively late in the campaign, because that will be when not just Pfizer and Moderna are available, but also any of the other 3 or 4 additional vaccines that will be joining the immunization campaign. And also because at that time, the vaccine will be available at multiple sites. So, let's say that we are offering Moderna in, at one site, and then another site is offering vaccine X. Well, if the person prefers vaccine X, might go to the second site. There could be facilities that are offering more than one brand at the same time. That could be possible late in the campaign, and then the person might make the decision just at that point. But most likely, it's going to be down to deciding where to go. Yeah.
Next up, we have Ms. Caitlin Newberg. Unmuting you now.
Hi, everyone. I'm from the Review Journal. I have two questions. First, does the district have any plans to update the tier system to follow the CDC guidelines that have patients 75 and older in tier 2? And then for my second question, we've kind of already touched on this, but do we have an estimate for how long it'll take to get through tier 2 and even into tiers 3 and 4?
Okay. The answer to the first question, and Joan, you can add there, regarding the 75 and over, that actually is not tier 2, is what they call 1B. And that will happen after the vaccine has been deployed through all the healthcare providers or workers. But the way that the tier is actually done right now is based on the state. So we follow the state guidance on that regard, and as soon as the state modify the tier system and make it consistent with the CDC system, we will proceed to do the same. Yeah.
Yes, so exactly. And as we, as we're moving along, we'll follow the state guidance and the playbook. But as far as tier 2, it's a big group, and so we will need a little more time with that tier, and it really depends on a number of factors: whether we get the vaccine, how people take up the vaccine. We had really good uptake with our healthcare workers, and really proud of them. But if there's not a lot of people in tier 2 who do not want the vaccine, then we move on to tier 3. So it really depends on those two factors. And so we'll be monitoring that, and we have plans for vaccine distribution to those tiers. And certainly, we're looking at teachers and childcare workers and all those folks that we want to get back to work. And so we will always have that in the back of our mind on our planning.
Our next question today comes from Mr. Orko Manna.
Hi there. Yes, this is Orko with Channel 8. I have kind of a two-part question. If you keep getting the shipments of the vaccine at the rate you are now, what's the latest projection for when the general public could start to be vaccinated? And when that happens, have you started to develop specific plans on how exactly you'll conduct mass vaccinations?
Okay. First, I should tell you that the amount of doses that we're receiving right now, those initial shipments are far from the amount of vaccine that we should receive in the future. Because remember, those two companies, they just starting to do the products and all the logistics associated with that. So that's something that's going to improve. But also, we should keep in mind that there are additional companies that will be bringing the products to FDA for emergency authorization coming January or February. Therefore, the shipments are going to be quite larger than today. But having said that, still the expectation for reaching the general population is actually something that we don't expect to happen before April. It would be very difficult to reach that population before April. Joan?
Yes, I would totally agree with that. I mean, it will depend on, like I said before, vaccine uptake is going to be a really big factor. And this is just the beginning. The vaccine companies are just ramping up. So as it becomes more available, we'll have more partners receiving the vaccine and not just us. And it depends on the product as well. Like Dr. Legend said, there's more products coming out, and how their storage is and handling will make a difference for some providers. We do have a lot of medical providers that are signing up to receive vaccine in the future. They're signing up to vaccinate their own staff, and then eventually they'll order vaccine for their patients as well. So it's really a comprehensive plan across the valley. It's not going to be just mass vaccination. It might be other areas as well. And we'll conduct strike teams to those areas where there may be more COVID in one area. Maybe we'll target that area more. We don't know. But that's a strategy that we used with hepatitis A outbreak a couple of years ago, and it worked really well. So it's really it's difficult to say at this point, but with this, we're very optimistic with our vaccine allocation this week, and we're ready to order possibly more today. We're still waiting on that. And we'll just have to take, each week and month at a time, really.
Okay, we're going to take a question from our chat box now. This is from Mr. Ken Ritter. He says that as of December 1st, statewide, the DHHS vaccine playbook says that there are 173,451 people in Tier 1 critical infrastructure workforce statewide. He wants to know, how many Tier 1 vaccine recipients do we have in the health district service area?
103,000 is what we estimate here.
Excellent. Okay.
300,000.
I'm sorry, say that again,
Right.
sir.
103.
I think it's like 140, 50, something like that, I think.
Yeah.
It's always like a percentage of our total population. We're about 75, 80%, somewhere in there. So that's what we would estimate on how many people, on how many vaccine recipients we have. And that's a good way to put it, as vaccine recipients, because we're not going to get probably 100%. It was figured that one of the calculations was about at least 80%. And so a lot of the vaccine estimates that we for ordering were based on that assumption.
Cynthia from Telemundo sent a follow-up question in the chat box to her question earlier. She said, so the distribution for Tier 1 will be executed by week. First the hospitals, then the long-term care facility staff and residents, and then psychiatric and substance disorder hospital, and so on and so forth?
Yes, pretty much. Now, when we get down to some tiers where those tiers are able to vaccinate their own staff because they have medical staff. When we start getting to other tiers, such as, say, our EMTs and our first responders, we have taught them how to give the vaccine too as well. So while they're doing that, then we're going to be doing pods for other tier groups. So you might have our EMTs doing their group, and we have our partners doing the laboratory workers, and or pharmacists, or medical offices. So it's not going to happen. The stepwide system we have is going to be a little more blurred as we get down to the lower tiers, because we'll have partners that will be able to help us some of the universities are like assigned a certain group. Say, for example, the dental offices. Our state dental office and our UNLV dental school is reaching out to that group to look for intent to vaccinate and get some logistics going. So when that comes up, then they're ready to go.
Okay, let's go back
That's
to.
it.
Oh, I'm sorry.
Well, that's okay, Corey. Go ahead.
Let's go back to Jacqueline Schultz from Fox 5 with a follow-up question.
I wanted to ask about, certainly as the Pfizer rollout has been happening, there's some concerns about allergies. I know some people have Moderna doesn't seem to have that kind of risk, at least right now, and so people are hoping for Moderna instead. When we talked about choice, I know it's going to be a little challenging, but how are we factoring in any potential allergic reactions in that, with Moderna perhaps having less of those side effects?
Well, actually, we try to prepare for a side effect of, whenever we administer vaccines, and actually at all vaccination sites there will be a dedicated area for observation. The person, once they are vaccinated, they will be observed between 15 and 30 minutes, just to make sure that the person doesn't suffer of any acute anaphylactic reaction or any other adverse reaction to the vaccine on site. Adverse reaction to vaccines are common to all vaccines, so it's not exclusive from Pfizer. It just happened that this is a new product, and of course we have to keep a closer attention to that, as we are. But our team is, our partners, they are prepared for that, and all those vaccination sites are just prepared to observe people when they receive the vaccine.
We have a follow-up question here from John and his wonderful baby.
Yeah, we'll see if Baby Watson makes a debut here. Okay, so just two questions for you. One, we had a question from a viewer who was an at-home nurse, or kind of a nurse that goes to people's houses. She's wondering if she's in Tier 1 and how she would get access to a vaccine in there. And second question for you, could you just give me a sense of, is it excitement, is it relief now that you have a second company producing vaccine and distributing it in Nevada?
Okay, John, you want to start?
Yeah, sure. Well, for the home health nurse, and we have, a number of nurses that do private duty. So we have pods for them that will be starting in January, and they will be invited to those. They should keep an eye on our website and for link to sign up for notification of those pods. But yes, we will have pods available for those individuals who are providing care. I'm sorry, John, what was the second?
Oh no, regarding the availability of multiple vaccines, or the second vaccine, of course we are very excited. We are very excited.
Oh yes, yes.
Just from the first vaccine, and we are just looking at the future and dreaming about a summer where most of our community will be protected against this virus, and hopefully we should be moving away from pandemic status. So yes, it's very exciting for us, and we are also waiting for the next vaccines that should be coming to the FDA for approval as well.
Yes, John, I was really happy to see Moderna come along, and especially now we have it tucked away, nice and neat in our freezer, and so that is a great deal of relief for me.
All right, everyone. At this point, it doesn't look like we have any further questions. Just got one in the chat box from Ken Ritter. He said, did I miss a response to Caitlin's question about whether people 75 years and older are being added or considered for adding to Tier 2?
No, actually, I believe I answered that question, and what I said was that the CDC recommendation is based on a different phasing than what you have here of the state, and that of course we are waiting for the state to make the the proper update on this. But what it means anyway for those 75 and over is that they will be in what they call a tier 1B, which is the group of the population that will be vaccinated after the healthcare personnel. So still that will be I would say faster than the current tier where they are now in our state system. So yes, that it means that they will be moved up in the timeline.
Cynthia wanted to follow up with this question. What about those with COVID who are hospitalized?
Well, being diagnosed with COVID is not a contraindication for this vaccine. Now, if the question is, will the vaccine be administered to somebody who is today admitted at the hospital? Well, the answer to that belongs to the attending physician and the team taking care of the person. But the answer in general is that a person who already had COVID, like thousands of people already in our community, they should be vaccinated with any of those vaccines, because the knowledge that we have today about how long the natural immunity that a person acquired after an infection from COVID, today it is considered to be about 90 days or 3 months. Therefore, the recommendation really is to any person who had suffered from COVID before, they should be vaccinated, because the expectation from the vaccine is that the immunity will last longer than the natural immunity from the infection.
We're going to take one final question for today from Jacqueline. One moment. And go ahead, please.
A couple things. Well, first of all, Moderna is eligible for those 18 and older. Pfizer was approved for those 16 and older. How, other than a pediatrician's offices, could we handle people 16 and up getting vaccinated? And then just a general question about education and encouraging people about getting the vaccine. A lot of people are hesitant. There's a lot of misinformation out there. And, Nevada doesn't have a great history or great record in terms of getting the flu vaccine. How do we tackle that? Obviously us as the media are trying to give the information as much as possible, but how are we going to address that as a state?
Well, okay, go ahead, Joanne.
Okay, so for those that are 16 to 18, we have processes in place for us to vaccinate 16 to 17-year-olds. 18s are considered adults, so they're all good, and they would come to a pod with their parent so that they can do the signed consent, just like we would do for any other clinic. And we would need to have Pfizer on hand then. As far as for our clinics, I'm sorry, well, the second part of the question.
It's about education, that's okay.
Oh, education, yes. So Dr. Leggen and I have been busy talking to our colleagues, our doctors, and I have a plan to reach out to my nursing organizations and start educating the providers and our those who are noted as trusted information sources for vaccine, because we know with vaccine hesitancy that a provider recommendation is one of the best interventions that we can do to combat vaccine hesitancy. So that is one of our strategies that we're using. And then there's always the education. We'll have things online. CDC has some things online. Immunize Nevada does as well. And Immunize Nevada has some campaigns planned, and then our campaigns as well. We'll be reaching out to those populations that are maybe not have higher rates than others, and so we'll be reaching out. We will be using, we'll be asking our nurses and doctors to help us get the word out.
Yeah, thank you. And thank you for the question. I just want to add that in addition to all those tools that we have been utilizing very frequently, especially regarding mass communication, we still are going to keep working on that in that area. But for this vaccination campaign, we really want to go to the root, and we want to communicate directly with community leaders and people who will help us reach all segments of our community, because we understand that there are many people who are hesitant with the vaccine, and just by watching the TV ad, it's not going to be enough. So we want to talk to the community leaders, and we want to be able to get as closer as possible to those members of the community, so they receive the message not just from us, but also from people they trust. And that's the way we want to do it.
Okay, before we let everybody go today, we just wanted to let you know that yesterday we launched a brand new, rebuilt from the ground up COVID microsite. You can get to it through our main health district website, or you can go to covid.southernnevadahealthdistrict.org. It's got lots of great COVID education. We've got a whole vaccine section with the FAQ. That's going to, of course, be updated whenever we get all these different pods and different clinics going on. Of course, the testing calendar is there, but feel free to promote that to your viewers and readers if you'd like. Once again, that's covid.southernnevadahealthdistrict.org. Thank you all for joining us. Happy holidays from the Health District, and please remember, we will be closed this Thursday and Friday. Thank you all, and we'll see you after the holidays.
Thank you.